Hello. Is your heart doing well? Or is it having some problems? Today I'm going to talk about the 7 signs that appear in your body that may indicate that your heart isn't doing its best. We know that cardiovascular disease is the #1 cause of death in the United States and worldwide. Here in the United States, the heart kills around 695,000 Americans every year. That's according to the American Society of Cardiology. What you feel when your heart isn't doing well. Could it be that you or a family member is feeling it? And at the end, I'll give you some valuable tips on how to avoid heart problems in the future. It's going to be a very comprehensive video, so stick around until the end, and I'm sure there's a lot you've never heard of. But first, please like the video, because the more people like it, the more YouTube distributes it to people who don't have access to doctors or hospitals. Also, share the video with your friends and family. Many lives can be saved with your help. So share it and tell me, do you have a heart condition, or do you think you do? 1. Chest aches and discomfort. Pain, tightness, pressure, or discomfort in the chestal area is a classic sign of a heart problem. Many people describe this feeling differently: a burning sensation or an elephant sitting on the chest feeling, but it points to a single conclusion: an unhealthy heart. Chest pains occur for different reasons. It can be due to 1. A blocked blood flow because of a blood clot. 2. Low blood flow, causing plaque formation that constricts the arteries. 3. Death of heart muscle cells. 4. Inflamed heart sac. This discomfort is usually characterized by a slow buildup of pain or tightening in the chest that lasts for a few minutes. It commonly happens while doing an exertive physical activity, but sometimes it can also arise when you are at rest. 2. Fatigue. Fatigue, or a prolonged feeling of tiredness, can be an indication of many illnesses. But not many people know that it is also a warning sign of impending heart disease. An unhealthy heart experiences difficulty pumping enough blood and oxygen to the body's tissues, causing you to be easily winded when doing simple activities. If you notice yourself getting exhausted quickly, which never happened before, after a flight of stairs or an errand, then you need to visit your GP, get yourself checked, and take care of your senior heart health. 3. Irregular heartbeat. Irregular heartbeat, also known as heart palpitations, happens typically as a result of too much caffeine, nervousness, or anxiety. But when it happens out of nowhere and in frequent intervals, then the problem lies in your heart. There are several reasons why an unhealthy heart increases its heart rate. This includes 1. To compensate for its loss of pumping capacity. 2. Changes in the heart muscles that causes scar tissues to develop. 3. Electrolyte imbalance. When you experience palpitations, it is crucial to note how it happened. Were you resting or doing a strenuous activity, how it feels, and how long it lasted? 4. Persistent cough. Typically, coughing or wheezing has something to do with your lungs or throat and not the heart. But if you experience persistent bouts of cough together with other warning signs mentioned in the article, then it is likely to be due to your failing heart. Coughs that result in the spewing out of whitish or pink, sometimes blood-laced, mucus indicates that something is wrong with your heart. This can be due to the buildup of fluids, sometimes blood, in the lungs because the heart cannot keep up with your body's demands. 5. Swollen lower extremities. Swelling in your feet, ankles, and legs may indicate compromised senior heart health. Many diseases can cause the swelling of the extremities: kidney failure, liver problems. That's why it is often overlooked as the sign of another illness instead of a heart problem. Edema, swelling, in the lower part of your body occurs when the heart cannot pump blood properly, causing deoxygenated blood to pool in your tissues. Heart problems can also cause the kidney to experience difficulties in removing extra water and salts in the body, thus retaining it in the tissues and causing the lower extremities to bloat. 6. Nausea and dizziness or lightheadedness. Feeling sick or feeling like you are about to faint can point to many mild health conditions. It can be just because of the food you ate or the lack of it, low blood, or standing up too fast. Nausea and dizziness are general symptoms of many illnesses. Still, when you experience it more often paired with other symptoms mentioned above, then you should not rule out the possibility of a heart problem. These symptoms happen due to 1. Low blood pressure because of the heart's pumping difficulties. 2. The digestive system gets poor blood circulation. 3. Not enough oxygen goes to your brain because of pumping problems. 7. Sleep apnea or snoring. Light snores when you sleep are normal, especially when you had a tiring and busy day. However, loud snores, together with a choking or gasping sound, might be an early sign of a heart problem. Sleep apnea refers to a bout of loud snores accompanied by seconds of breathing pauses during sleep. It can also be experienced with chest pains, restlessness, and choking sounds. Not all sleep apnea indicates weakened senior heart health, but it can cause or worsen one's heart problem. Moreover, studies suggest that it causes hypertension and heart palpitations, which can exacerbate or trigger heart disease. 7 symptoms of heart problems. There are common symptoms that could indicate a heart problem. If you experience any of the following, it's crucial to seek medical attention promptly. Chest discomfort, uncomfortable pressure, squeezing, fullness, or pain in the center or left side of the chest. It may come and go or last for an extended period. Shortness of breath, difficulty breathing or sudden shortness of breath, which can occur with or without chest discomfort. Pain or discomfort in the upper body, this can include discomfort in one or both arms, the back, neck, jaw, or stomach. Cold sweats, profuse sweating, especially when not associated with physical activity or a hot environment. Nausea or vomiting, feeling nauseous or vomiting, which may be accompanied by chest discomfort or other symptoms. Lightheadedness or dizziness, feeling dizzy or lightheaded, especially if it is sudden or severe. Extreme fatigue, unexplained fatigue or weakness, often more pronounced with exertion. Irregular heartbeat, arrhythmia, feeling that your heart is racing, fluttering, or beating irregularly. Swelling in the legs, ankles, and feet, fluid retention, which may indicate a heart problem affecting circulation. Persistent coughing or wheezing, coughing that produces white or pink blood-tinged phlegm can be a sign of heart failure. It's important to note that some people, especially women, may experience atypical symptoms, such as jaw pain, back pain, or extreme fatigue, rather than the classic chest pain. If you have concerns about your heart health or experience any of these symptoms, it's crucial to seek medical attention promptly. Early detection and intervention are key to managing and treating heart conditions effectively.